Welcome to A Window on SAHMRI, where we take you inside South Australia's independent not-for-profit health and medical research institute. Each episode, we get to know the people driving our life-changing research, getting into what motivates them personally and how their work is delivering a brighter, healthier future for all.
Tom, what first sparked your interest in the health and medical zone?
So I guess I came from a family of health researchers, health professionals in one form or other researchers in my family. And whilst I probably didn't have the technical and applied parts of what you need to be a great researcher itself, I sort of felt like I was interested in how research responds to, our needs, the community's needs. But it doesn't happen necessarily naturally. And, I felt I have built up a knowledge and an understanding of those systems to really help that happen. And I guess, my childhood was in and amongst health service professionals that, I could see the difference that health professionals made to people's lives every day, and felt that, I wanted to be part of both in terms of healthcare delivery, but also training healthcare professionals and ultimately health and medical research, how I could facilitate a system that made that difference for a greater amount of people.
Did you see examples where research was being done, but it wasn't translating, or perhaps there were opportunities to be able to make research more impactful in communities that you saw?
I look at when I started in healthcare management. So, in the day-to-day job of overseeing how health services are provided, predominantly in hospital settings. And, and I think all people that work in the health service often question, why is it we do a certain thing the way we do them? What is the evidence for this other than the way that I've been taught, or that it's custom and practice? And most people sort of are open to the idea that, that we should be continually improving the way that we do things. And we need evidence to make those decisions on what we change. I guess there is lots around. In fact, there are lots of studies that talk about how anything up to 3/4 of all health and medical research doesn't actually get translated into policy or practice. There's studies that show that, depending on which publications you look at, that, up to 70 or 80% of most healthcare activities, interventions, are not actually based on an evidence based at all. And, I was always fascinated, working the healthcare delivery side of things as to why that was, when most healthcare professionals are continuously asking the same questions, want to do the best for their patients, want to apply best practice, but it takes such a large concerted effort to see research translate into life-changing, practice.
And we need to have a better answer to that question than, oh, well, that's how it's always been done.
Yeah, exactly. And I guess my broader background and my broader interest is around how people work together. And it is around that idea of how change and collaboration and undoing, things that we take as a given, do really manifest itself in that translation.
So what brought you to Australia?
Well, I am Australian. So I was born here on Ghana land in Adelaide, and in the Queen Vic Maternity Hospital, actually on the day it opened, bizarrely enough. And then my family, my father and my mother took me over to the UK.
How old were you then?
I was 4.
Because I was just thinking you can't have been born here with that accent.
No, well,
you didn't go somewhere.
37 years later, I returned home
with
my family. 37 years of my life, with a few trips here or there, but I had pretty much that solid time in living in the UK. And so, yeah, it's been a fascinating sort of experience of my life, transposing my life from Australia to the UK to then do the same to my kids the other way around and seeing how life has changed.
So did your family have a connection to Adelaide once they left for the UK?
Yeah. So my parents were fourth generation South Australian. So I had all my grandparents and cousins still in Adelaide. So when I finished university in the UK, I had just met this wonderful individual who now 30 odd years later is still the wonderful individual in my life, and brought her out to Australia, and we stayed in Adelaide for probably about 9-12 months, and I was playing music in bars and stuff like that, and we just had we said, like, this is the place, this is where we want to go. Life took over, we went back home skint, and and a couple of mortgages and 2 kids later, we finally returned.
Okay, and since you've returned, what have you been doing career-wise?
So I came over as I had been worked at that point for about just under 20 years in the National Health Service in hospital management. So I got an opportunity to come over and work in hospital services and worked down Southern Adelaide. So was the general manager at Flinders Medical Centre and also looked after the Repad Hospital and Noarlunga Hospital at the time. So that gave me a fair baptism of fire into the challenges of moving health systems and health services, but formed some fantastic relationships with the clinicians and the university down in the south, and that's then helped me with a move into the university sector. So then I moved into academic health management at Flinders University, really developing it both initially in the School of Medicine, but then broader across the other health faculty areas, an understanding of the pipeline of health professional training and education development, but also research and health medical research. And then I essentially evolved into a role in the university as a main sort of research and development support manager, both within the health medical areas, but also more broadly across the university. Then, whilst I was working in the university, I started to develop interest in governance and particularly reflecting some of the work I'd done as a health service manager about community and consumer voices in shaping health and research. So I took on a role as a community member on a number of bodies in terms of ARPA and the medical board, but also joined the primary health network in Adelaide, initially just as a community advisory member, and then ended up getting onto the board and chairing the board of the primary health network for 5 years, which I've just finished and had a fantastic experience and learnings from all that. And then finally, my last role before where I am now in Health Translation SA was working for the state government, developing innovation districts across the state. So Lot 14 and Tonsley and Tech Park and other places around how we bring together research, industry and government to really drive innovation for the betterment of the community.
So that's a very diverse, comprehensive range of experience. What's that taught you about improving health systems, particularly here in South Australia?
Oh, look, I think it's brought home the fact that, health system improvement has to be driven by those that receive the benefit of that improvement. So fundamentally, the members of the community, you and I and our families, and those particularly who are most in need in the community, driving the shaping and the prioritization of health. There is then a connected part of that, which often gets described as the end users of research, which often are health practitioners or those that are in the healthcare settings that support and provide care for the community, and they are equally as important as early ownership for change and accepting new ways of doing things and practice is really important. That voice of health services and healthcare deliverers is a big part of it. I think so often wonderful, amazing research, groundbreaking research, the struggle it has to translate is often because of that disconnect in terms of both community as well as health practitioner involvement as early as possible in all that work. Australia's great at really, really great at discovery-based sort of research, and there's some fantastic examples of that in South Australia. But the translatable, as I mentioned, is the really tricky part of the whole pipeline, the whole ecosystem, is how you actually get that into day-to-day practice, and that common paradigm of it being 17 years from groundbreaking discovery in the lab to being in the community through the clinic is something that everybody wants to try and shorten and change for the better.
How would you summarize what the key is to speeding up that timeline?
Being very clear on what the barriers are. There are a number of important steps to safely bringing on board new research findings into practice. That it's not something that should be done without checks and balances in the process. But there are a whole range of other sometimes human level barriers to change. There's obviously a lot of system wide and policy tensions in how health services are set up and delivered, and how the research community and the health service community often are working sometimes to quite different policy drivers that shape the way that those organizations have to work, and sometimes that gets in the way of those real important collaborations. So there's a number of, and as I said, the fact that research needs to be truly driven by the needs of the community, and that there is a true co-design process to research always helps with how quickly you can then translate it. It always helps with how quickly policymakers and funders of healthcare will receive that in a favourable way, so that it does become a reality.
And this is the crux of what Health Translation SA does.
Correct. And
what you're leading in your new role. What are your priorities since taking up that role?
Look, Health Translation SA has been going 10 years now. I've done some fantastic work. We are part of a national collaboration of these entities called Research Translation Centres. There's 12 of them. Health Translation SA is the only one in South Australia, and it is a statewide research translation centre. We are based with one of our partners, SAHMRI, but it is a statewide. And I guess for me, it is reaffirming the fact that we are here for all parts of the health and research ecosystem, that we are driven by the needs of our community. And so therefore, for me, it is around ensuring that we have a really strong sense of purpose and priority to our work from that perspective of the needs of the community and the health service. So a big part of what I've been keen to explore early on is how that might look with our partners going forward, particularly our health service partners. The interactions between HTSA and universities is very strong. I know that from our conversations and my own background knowledge, the need to strengthen the relationship between the research community and the university sector particularly, and health services is absolutely what everybody wants to see. And I think that's where HTSA can really make a difference, because we are hopefully seen as a sort of trusted independent partner in that process.
How do you go about bringing those worlds together?
There's a number of things. There is opportunities for how UNISA brings together, convenes, if you like, collaborative opportunities that possibly may not become apparent to separate parts of the system working independently of some organization that brings to the table the opportunities from a national or a local level to bring particular parts of the system together. And we've got some great examples where that's happened. I think there is a sense that we have to develop still people's skills and knowledge around research translation, both in all parts of that system. But I think in particular, with working with our colleagues in the health services, how clinical researchers particularly can see and understand the mechanisms for true research translation and what are those elements. So we run some fantastic courses, including a research translation essentials course. One part of research translation, as I said, is consumer and community involvement. We run courses for consumers and researchers to come together around consumer and community involvement in research. Very powerful discussions, together, talking about how we make it translatable.
What's the uptake like?
We've had a broadening uptake of individuals from as those 5, 6, 7 years of those courses have been in place, and I think there is a sense now that we've got a reasonable critical mass of expertise in that space. But we've always got the need for new emerging researchers, new emerging priorities of how we address things in health, for example, digital health, that continuously change the content and the application of that knowledge. So, we are refreshing those courses continuously and seeing new individuals, sometimes people who have had no research background at all and are just coming to research because they want to know how evidence can improve the way they do things.
Do you have senior researchers who've been in the game a long time who are rethinking the way that they go through their processes, or are people generally stuck in their ways and not particularly open to that later on?
No, I think researchers, clinical researchers, are pretty adept at recognizing, that nothing stays the same. Research, the whole body of research that drives new knowledge, drives new ways of thinking. And I think clinical researchers see and feel that all the time. And in many ways, we've got some amazing research leaders in South Australia that lead the stage nationally and internationally. And, and I think South Australia is really well set for working in a much more collaborative way as a whole system than some of perhaps the bigger states, where there is, I'd say probably a greater competitive sort of dialogue between health systems and researchers and universities and what have you. And I'd like to think that South Australia has individuals that are keen to see us, to really rise to the top and be held up in high regard nationally and internationally. And so they're good to keep their skills refreshed and their knowledge updated.
What's the benefit of having HTSA housed at SAHMRI? Can you just go a bit into that specific relationship?
Sure. Yeah. I mean, HTSA, as I said, is one of 12 research translation centres. Commonly, other translation centres are housed in one university, interstate, some in other research institutes. The great part about the linkage with SAHMRI on an administrative level, obviously they host and provide amazing support services for our team, which is only a fairly small team, but they are in akin to HTSA. SAHMRI was created by a collaborative endeavour. It's a joint endeavour between the parts of the research and health ecosystem, and HTSA is exactly that as well. So I think there is a very strong meeting of minds of purpose around SAHMRI is all about research translation into the community. Our research director, HTSA's research director, is also Maria Macready, is obviously the ED of SAHMRI. So I think that we amplify each other's messages really well in the way we work. But, we are keen to ensure that we are always seen as an independent broker, if you like, of collaborative relationships, and and being in the centre of the city is convenient, but actually we're very much about our relationships with rural, regional, and remote, as well as other institutions outside of the CPD as well.
What would you say to early career researchers in particular about making their work more translatable, or thinking about that before launching into the next study?
Fundamentally, the benefit of the research that you're doing and how and where that is going to manifest itself. There's obviously, like I say, there's a pipeline of research that is all the way from discovery through to translation, and each has a role to play, but it is a connected ecosystem. So understanding where your particular research fits in that, and particularly where what it's driven by, and where it is going next, I think is really important. And as I said, part of that is understanding, particularly if we're wanting to either translate this to the next stage of that pipeline, or even take it further into changes into policy and practice, is to think about the barriers that get in the way of that, as I've talked about in relation to end users, the community, the policy and the funding parameters that are always going to be there. Think strongly about those things, and then that will help undoubtedly how you design your research, both your individual research projects and the things that you try and bid for in terms of grants, but also your own research career as well, and how you can sort of see the opportunities to form collaborative relationships with key parts of a system that will further your research and further your research career.
Is there the opportunity for anyone doing research in the building and further afield to come and meet with HTSA and discuss this and get a breakdown or get a perspective shift around
Absolutely,
things?
definitely. So we run a number of get-togethers in terms of meetings for researchers to join. Like I said, we have a number of networks that we run, and that are for anybody to join. SAHMRI is an open door as a building. We're based up on level 8. We're a small team up there. We have a website that you can connect in and get on our mailing list. But at the end of the day, contacting me or any of the team for any questions around advice, we will either directly hands-on help you, or certainly put you in touch with those that can as well.
And are you finding that's picking up?
I think it's always important to recognize that you can't just sit on your laurels and expect that people know about you and where to find you. So we are continuously thinking about our communications and our engagement approach. But we do have a steady stream. To be honest, it's a gratifying thing, but it's also a challenging thing that we have demand for help probably that exceeds sometimes our abilities to do everything we can. It is always a balance between really prioritizing how you respond and what you respond to, as well as wanting to provide an open door and finding the right help for the right questions from others, as well as within our own team.
As you mentioned, research is always evolving. We need to keep up with the times. And then, of course, AI is evolving exponentially at the moment. How do those worlds collide, and how is it already changing the work that you do, and what do you see happening in the coming years?
Yeah. There isn't a conversation that I'm not part of at the moment that somewhere AI isn't put on the table as, how do we maximize the opportunities from this, and how do we minimize the threats and the concerns that people might have around artificial intelligence in healthcare. It is an interesting aspect, though, that most elements around how research and AI is driven much more towards, if you like, a more consumer and patient sort of centered empowerment approach to how information is given back to patients and families and what have you, to take more, in a sense, control over their healthcare and their own health conditions. And I think that's a fantastic thing. But there is obviously, it's still of quickly emerging and probably late in the day emerging set of governance and principles and ethics around the use of AI in health that we cannot ignore and shouldn't ignore. But I think the research community are much more driven about what are the opportunities for how AI improves the quality of care, ultimately the outcomes of healthcare, but also the experience for patients and families.
What's something that you're excited about with the potential there for AI?
There's often a phrase that health services and health and medical research is data rich, but intelligence poor. There's a huge amount of health data in and around everything that we do, and there are real challenges to, particularly in health systems like Australia, where the connectivity between parts of the system and the data that's within it is strained or non-existent. And that data is clearly part of the engine of how individual healthcare can be provided better, how individual health status can be better understood. I think AI has an undoubted ability to sieve through a lot of that information and provide real-time information intelligence that would help people with their health journeys, help researchers with their next questions that they're going to need to look at. And actually, when we talk about translation, speed up the process by which, evidence gets into practice. I think it's all part of that story.
And you can't spend all your time doing health translation. What do you do outside of work?
Well, outside of work, I'm a dad.
How many kids?
I've got 2 kids. Both have now, well, I'd like to say have grown up. That could be a bit debatable.
How old are they?
One's just turned 21, the other's 24.
Okay. So have you kicked them out of home yet?
Yeah, one's gone. Yeah. And
one to go.
One to go. Yeah. And very different kids, but great kids, fantastic kids. And, and like I say, my reason for coming back home was to connect them to the place that I've always loved, which is Australia and South Australia. And they've thrived being here, no doubt about it. Otherwise, I'm a bit of, I like to cook, and I also a bit of a muso and a bit of a music person. I have been for all my life. Music is a big passion of mine. And
what do you play?
I play a bit of guitar.
Oh, yeah?
Mm-hmm.
Electric or?
Mm-hmm.
Oh, okay.
Yeah.
A few solos?
Solo, you can't hear me. Yes, that's the one. Yeah. But
very cool.
I suppose my career started, in a way when I was a bit of a would-be rock star, pop star at the wanting to be, and then realised I had no money. And
okay. Did you have the vocals to match?
That's for others to comment. I don't know if I could.
Isn't having no money great content for songwriting?
Oh yeah, it certainly was. Yeah, definitely. Yeah. So
it's never too late.
No, yeah, it's true. I mean, I still play I play in a band now, and it's just good fun. It's great therapy.
What's the band?
So I'm the youngest in the band, so that tells you. And and
the most talented.
Well, again, I wouldn't want to blow my own trumpet. I used to play the trumpet, but I don't anymore. So we do it for fun. We play various gigs, play sort of covers and stuff like that. But I'm trying to get them to play something after 1990.
Okay,
that's a bit of a struggle.
Trying to modernise it a bit.
A little bit.
What sort of covers is your specialty?
We do a mix of stuff. Everything from the Beatles to the Bowie, Roxy music. We might play some classic sort of rock and roll stuff, and a few sort of great sort of Aussie hymns and stuff like that.
So pub gigs here and there?
We do. We play at the Gov every now and then.
Oh, nice.
Yeah, and play benefit gigs, not pub gigs really. So we have to play these great gigs for
the benefit niche.
Yeah. It's probably because we're cheap. In fact, we don't get paid at all. So that's why we get
cheap as you can get.
That's what we get.
And what's your best dish?
Best dish, definitely.
It's not something like cod or something awful.
No. I'd say
black pudding or whatever.
It's a proper butter chicken.
Oh,
from scratch.
Well, UK is famous for the curries, aren't
Exactly. And that's the reason why I went. Well, apart from the music, why I went to Manchester.
Okay, what's the key to a spectacular butter chicken?
don't skimp on the butter, obviously, but particularly it's the grinding of and the heating of the spices to start with, and the marinade the chicken as well.
All right. Well, it's making me hungry. Perfect. Thank you, Tom.
No worries.
If you want to learn more about SAHMRI and the researchers working to build a brighter, healthier future for you and your family, head to samhri.org.au.